You are hiding your health history because you fear it will disqualify you. That is exactly how you make yourself look like a risk. Transparency is your greatest asset. Many applicants hide chronic conditions like diabetes or hypertension because they fear it will derail their application. This is the worst strategy you can employ. A hidden condition is a liability. A disclosed, documented, and managed condition is a data point. When you hide facts, you force a decision without them. When you disclose, we can work within the framework of the law to show your condition is under control and does not pose a threat to public health. Most chronic conditions are not barriers. They are simply factors that require documentation. Documentation is what builds a defensible file. My goal as your civil surgeon is to ensure your medical file is complete and defensible. If you are managing your health, be proud of it and document it. Bring your medication lists, recent lab results, and a letter from your specialist. This shows you are a responsible, proactive person. That is the kind of record that makes for a smooth, fast approval. Failing to report and having it appear unexpectedly, that is a reason for a massive complication. Honesty and thoroughness are your best tools. We operate our St. Louis office to be a hub for such precision. Don't worry, start preparing. We provide the expertise to ensure your health history is your ally, not your enemy. We don't want to guess. We want to document for certainty. Now, let's dive into the USCIS policy manual. Understanding the distinction between Class A and Class B conditions is critical for your application. Class A conditions make you inadmissible. These include communicable diseases of public health significance, lack of vaccinations, or drug addiction. Class B conditions are physical or mental disorders, serious in degree or permanent in nature. Most chronic illnesses like diabetes or heart disease fall here. Crucially, a Class B condition does not make an applicant inadmissible on health-related grounds. It is a departure from normal health, but it's manageable. The USCIS regulatory framework, spanning Volume 8, Part B, Chapters 6 through 10, provides the exact definitions for these health-related grounds. Chronic mental health or physical disorders only become a ground of inadmissibility if they meet specific criteria involving safety risks. This is governed by Section 212. The two-prong test requires both a diagnosis and associated behavior that poses a threat to safety or welfare. One without the other is insufficient. Examples of harmful behavior include violent outbursts, history of self-harm, or alcohol-related driving incidents like DUIs or DWIs. A person with a chronic diagnosis, such as schizophrenia, who is stable on medication and has no history of violence, would be classified as Class B, admissible. While a Class B condition isn't a health bar, it can influence the public charge ground under Volume 8, Part G. This is a critical distinction to manage. Officers consider if a condition will interfere with your ability to work or require extensive medical treatment at public expense in the future. The Class B notation serves as a signal. We use your documentation to prove to the adjudicating officer that you have the resources and support needed. Consider the historical shift in 2010 when HIV was removed from the Class A list. This marked a significant change in how chronic infections are handled. Civil surgeons follow strict CDC technical instructions. These clinical findings are what drive the legal consequences determined by USCIS officers. Alcohol use is treated differently than drug addiction. Because alcohol is legal, it only results in inadmissibility if tied to a mental disorder with harmful behavior. A record of alcohol-related arrests may prompt a request for evidence, or RFE, to determine if there is a Class A mental disorder present. If we are unsure about a chronic mental health condition, we refer you to a specialist psychiatrist for an in-depth evaluation before final classification. Your Form I-693 generally retains its evidentiary value for 2 years from the date I sign it. This builds long-term certainty for your pending application. We look at the biological soil, markers like LDL-P, TNF-alpha, and IL-6. These are the strongest metabolic predictors of your health stability. We advocate for metabolic sovereignty. Addressing central obesity and visceral adiposity is key to fixing the terrain and ensuring a clean medical record. Muscle is the organ of longevity and the body's primary metabolic sink. Preventing sarcopenia is essential for structural and metabolic integrity. As a triple board certified physician entrepreneur, I reject the assembly line medical model. We perform a forensic audit of your health, not a factory check. Our 18,000 square foot St. Louis facility is a specialized outpatient environment, completely hospital-free for your comfort and safety. We serve high agency applicants, sovereign seekers, who want to ensure their health history is an asset in their immigration journey. The PADA protocol ensures your medical file is complete, defensible, and aligned with the latest USCIS standards. we document for your success. Transparency is the best tool you have. When you document, you build certainty. Stop worrying and start preparing with the precision your future deserves. For diabetes, bring your HbA1c records and glucose logs. Showing compliance is how you demonstrate that your condition is Class B and under control. Hypertension requires documented blood pressure logs and a cardiology clearance if applicable. This evidence is your ally against inadmissibility. Autoimmune issues are not barriers when they are documented and managed. We work with you to ensure your specialist's records are properly integrated. As a USCIS designated civil surgeon, my responsibility is to provide the facts. When you provide the documentation, we provide the precision. Mitigating the public charge ground requires showing you have the financial resources and private insurance to manage your health long term. Our St. Louis office is a hub for such precision. We ensure every line on your Form I-693 is defensible and accurate for your specific situation. Booking is simple. Visit immigrationexam.us or text us today. We provide the expertise you need for a smooth, fast medical examination. At your exam, we perform a thorough history and physical, order all required lab testing, and review your vaccination records for complete compliance. The evaluation is thorough. We perform a physical exam and a mental status evaluation, looking for signs of harmful behavior or chronic substance abuse. Most applicants complete their entire green card or citizenship medical exam in just one visit. We handle the labs, the exam, and the paperwork. Think of this as medical jurisprudence. We follow the CDC standards to ensure your health-related findings are legally defensible within the USCIS framework. We offer a 100% money-back guarantee on our paperwork. We stand behind our precision because your immigration success is our priority. The applicant has the burden of proof to show they are not inadmissible. Our documentation is what carries that burden for you. Located at 4477 Woodson Road, we are conveniently situated right next to St. Louis Lambert International Airport for easy access. If a Class A condition is found, in limited circumstances, you can apply for a waiver via Form I-601. We provide the medical data needed for that process. Be transparent, be prepared. Don't let your health history be an enemy. Make it your ally with the right documentation and the right expertise. Modern policy is clear. Intellectual disabilities are not grounds for inadmissibility unless tied to harmful behavior. We ensure modern standards are applied. Contact us at immigrationexam.us today. We are here to help you build certainty in your immigration application process. Bring your ID, passport, vaccination records, and all specialty medical reports. This preparation is the key to a one-visit completion. Great. Text us at 314-886-5902. Let's start preparing your medical file for success today. Fix the terrain. Manage your metabolic predictors. Secure your metabolic sovereignty. We are your partners in this forensic health audit. immigrationexam.us. Precision, transparency, certainty, fixing the terrain for your immigration success.